Susac syndrome is a rare condition that was first reported in 1973. The syndrome is characterized by a clinical triad of encephalopathy, sensorineural hearing loss, and visual disturbance resulting from branch retinal artery occlusion. It had been initially termed small infarctions of cochlear, retinal, and encephalic tissues syndrome, or retinopathy, encephalopathy, and deafness microangiopathy syndrome. Susac et al. Described it in 1979, and Hoyt named it Susac syndrome in 1986. The encephalopathy is manifested by headache, motor deficiencies, sensor deficiencies, aphasia, cognitive impairment, and urinary insufficiency. The hearing loss is usually bilateral, and it can be associated with tinnitus and vertigo. The branch retinal artery occlusion may be extensive or subtle, and unilateral or bilateral. The specific etiology of the syndrome is unknown. However, it is believed to be an autoimmune-mediated condition that caused microinfarcts due to endothelium-induced occlusion of the microvessels in the central nerve system, inner ear, and retina. The diagnosis is difficult to establish since the full clinical triad rarely exists on the first presentation. Workup for Susac syndrome includes magnetic resonance imaging, retinal fluorescein angiography, and audiogram. Although its prevalence is rare, Susac syndrome is an important differential diagnosis for several neurologic, psychiatric, ear, nose, throat, and ophthalmologic conditions. Treatment in the acute period may include high-dose glucocorticosteroids with a fast-onset immunosuppressive drug. Intravenous immunoglobulin and plasmapheresis may also be a beneficial adjunct. Hearing aids and cochlear implants can be offered to improve quality of life for those left with hearing loss. There has also been discussion about the use of antiplatelets, but these have not been shown to be beneficial. Prognosis for Susac syndrome is generally favorable with central nervous system, and visual symptoms typically resolving with some compensation. However, hearing loss may be permanent, and in rare cases, the neurological effects of Susac syndrome can progress to dementia. Remember the characteristic clinical triad of Susac syndrome. And remember that it is currently considered to be an autoimmune endotheliopathy that caused damage to the microvasculature of the brain, inner ear, and retina.